beginning. But I just wanted to introduce myself to people who don't know who I am. My name's Dr. Nicholas Dodman, and I ran the animal behavior program at Tufts for many a year, retired in 2016. And the last part of my professional career I'm dedicating to animal welfare. And in that context, I co-founded the Center for Canine Behavior Studies that's putting on this presentation today, along with a friend, Chris Gianelli. And our mission is slightly different from other people. And we think, for example, that ASPCA does wonderful work in placing dogs that already find themselves in shelters. Ours is more on the preventive side, that we think through information and knowledge, we can teach people what to expect, better cope with issues that might arise, so they don't actually surrender the dog in the first place. So instead of doing the fire engine service, we're really the preventive service. And we've done a lot of good work so far and continue to do amazing things with the help of our membership, who turns out are citizen scientists. They fill in surveys for us, they tell us about their dogs. The information is carefully crunched by our informatics specialist, Ian Dinwoody, who's on the screen now. And we process things and do heavy duty statistics and publish things in articles and try and disseminate in other ways through our Facebook page and our Instagram account and so on. So the idea is to get the information out to the people, so every dog, we hope, ultimate goal, has a home for life. Our first study was about animals, owners, how they interact and the effect of human personality on dog behavior. And yes, indeed, there is an effect. Our second study was on the demographics of dog behavior, because if you don't know what you're dealing with and how much of it's out there, you can't really get a good handle on it. And that article won the Welfare Award of the Year from the Journal of Veterinary Behavior, where it's published. We're talking about today about a study with aggression treatment, which we did. We took nearly 1,000 dogs that owners report as having aggression of different types. We sorted them out into different buckets, asked them who they went to see, the specialist they went to see, whether it was a trainer, a veterinarian, non-veterinary behaviorist, or a veterinary behaviorist, what program we used, what techniques we used, what equipment was used, how did it work out for them. So that will be sort of the focus of today's discussion, is treatment of aggression. Just telling you that we also have a puppy study that's just been published about the effect of puppy training. And bottom line is, it doesn't seem to matter whether it's the first 3 months or the second 3 months of a pup's life. When it's trained, you get the same beneficial effect. So it's highly recommended. We also have studies in the wings about CBD, how people are using it, what they're using it for, how well it's working out for them, and so on. And another one about light chasing in border collies. We have many more studies, some of which you'll hear about in the wings. We encourage you to join, be a member, be a citizen scientist, and help us out in our endeavors. With that, I'll pass over to Ali, who will tell you more about the format, and she's going to be the host today and direct questions to various specialists.
All right, thank you, everyone. So I first want to start by thanking you for your time and attending on this Monday afternoon. I appreciate that some are already using the chat feature, and hearing that a couple people are having speaker issues or hearing us. I think the majority are able to hear us, so I'm not sure it's an issue on our end. I'm hearing a thunderstorm just above me here in central Massachusetts. So if it hasn't happened, it hardly does, but if I get booted, our team member Ian Dinwoody is going to take over. But again, knock on wood, that should not happen from here. So if you're having an issue hearing, you can try to sign out, sign back in. That sometimes works. Outside of that, there's not much I can do. But we do appreciate that everyone stays muted so that we can just hear each other that much better. I read a note from someone. If someone's having trouble with their videos, if viewers turn their videos off, it helps with the bandwidth. So that's beyond my IT knowledge. But anyway, so for the next about 30 minutes till around 4 o'clock, we're going to hear from our experts on our team, and they're going to share the findings from our latest study on the treatments of canine aggression and how it impacts you and your dogs, or the dogs that you care for. Our group today is made up of dog owners, trainers, animal welfare professionals, veterinarians, and just dog enthusiasts. So thank you for doing what you do, and thank you for loving dogs the way you do. Our paper was first published in the Journal of Veterinary Behavior. And for those of you that tried to access it, you noticed that you may have had to pay to read the whole thing. That has since changed. So until June 28th, the paper is now free, fully accessible to anyone who'd care to read it. So feel free to browse that, and it may answer some of the questions that we may not be able to get to today. We had a great response and a number of questions asked, I think close to about 95 questions. So we're going to try to cover what we can, but don't worry if we didn't get to your question. You're welcome to resubmit it, and we'll try to answer again as many as we can. But this is going to be the first of many events that we have like this on a number of different topics. So if you have an idea of a topic you'd like us to cover, feel free to send us an email. And all of that's available on our website as well, which is dogstudies.org. A couple just housekeeping things. Again, we appreciate you keeping muted, and the speaker view, if you click speaker view or gallery view on my window, it's up at the top, you'll be able to see who's speaking. So it's my pleasure to introduce the authors of our study. Ian Dinwoody is the chief author of our study, and he's also our chief data scientist. And we have Vivian Zatola, who's also on as well. Vivi, give a wave if anybody sees her. Vivian is a co-author and a CCBS research associate. She's also an anthrozoologist and certified canine behavior consultant, and she's the owner of Boston Canine Concierge Dog Training located in Boston, Massachusetts. Rounding out our team who aren't with us today is Donna Gleason, who's a certified dog behavior consultant and the owner of TLC Dog Training in Fairfield County, Connecticut, and also Steph Tobin, who's our social media associate. So we appreciate their time and contributions as well. And Ian, I'm going to pass it off to you and ask if you can summarize our latest study.
Hello, everyone. So Dr. Dodman started with an introduction, and I think he had mentioned part of the study. So I'm just going to give a brief overview on both the technical aspects and some of the results. This won't be an extensive evaluation of the results, so that way we have time to answer questions. But to begin, in 2017, we launched a two-part study via the REDCap electronic data capture platform. It's a clinical EDC. And the first part aimed at collecting data about the prevalences of various behavior problems across the canine population. And the second part of the study aimed to identify the pathways of resolutions for each of those behavior problems. So since this is our regression study, we isolated out the 963 complete responses for dogs whose owners believed they had indicated some form of aggressive behavior. More than half of the dogs for the study were taken to at least one type of professional for treatment. 15% of the dogs that saw a veterinarian were found to have an underlying medical problem related to the relevant misbehavior. We found that anti-bark collars and muzzles decreased the probability of success for treatment of aggression. However, we did find many forms of treatment that correlated to a positive response to treatment for aggression. And those included systematic desensitization and counter conditioning, response blocking, short and frequent training sessions, and there's many more detailed in the publication. So that is my simple summary overlying this publication.
Fantastic. Thank you, Ian. I just wanted to mention again, in case there's anyone late that's joining us, we're going to try to answer as many questions as we can that are related to the study and dog aggression. If you have a question, you're welcome to put it in the chat and I'll do my best to check it. But again, we're going to try to answer questions after this in a different format, whether it's through email or in a different event. So thank you for your patience and enthusiasm as well. To start off our first question, Ian, it's actually for you. Rachel asks, can you address how you distinguished the correlation from causation in the study? For instance, how can we decide if certain training approaches are truly more effective for treating aggression compared to owners of dogs with more severe aggression being more likely to resort to different training approaches?
That's a great question. So when you do analysis, you calculate correlations. So correlations are evaluating the statistical strength between two various items. So maybe an input and an output. There is no statistical determination of causation. And so whenever you approach analysis, you need both statisticians and experts in the field. And so our team has a blend there, and I rely on Dr. Dodman heavily to assign causation when statistically significant correlations are found. And so it's the balance of statistical knowledge and knowledge in the field that allows causation to be assigned to various correlations.
Great, great, thank you. The next one is for Dr. Dodman. Cynthia asks, which underlying medical condition is the most noted when an aggressive dog is brought in a vet's office for assessment?
Well, as you might expect, pain, which has been well known to increase aggression over the years, people have always said, you know, if a dog's in pain, it will likely be more reactive and possibly aggressive. Another question we're going to answer later. So pain was the number one problem. The number two problem was seizures. And there are such things as behavioral seizures, notoriously the famous rage syndrome. And even just bordering on a seizure in the premonitory phase or in the recovery phase, aggression can be a feature. So that obviously has to be worked out before anyone starts training. We found people reporting without detail, but they said thyroid issues were discovered as underlying their dog's aggression problem. My guess would be that it would be low thyroid, but hyperthyroidism, too much thyroid hormone, does occur in dogs with thyroid tumors, and that will increase aggression too. And I think there were one or two other things. Some people just said other, which we couldn't really interpret. But those are the main ones that we found. And certainly it does make the point that if your dog is aggressive for any reason, the first place port of call would be to the vet to make sure there's nothing medical going on underneath that could be sort of somehow contributing to or even causing the problem.
That's right. And that's such an important reminder, is to always check with a veterinarian first. And it's so similar to humans too, right? I mean, you want to make sure you're checking off all the boxes while you're trying to get treatment and get well. So thank you. Ian, this next one is for you. How many of the dogs in this study had more than one behavioral concern?
So we don't have a figure specifically for the dogs in this study of that subset of aggressive dogs. However, in our 2019 demographics paper, we reported that the dog population that we were pulling these aggressive dogs from had an average of 2 behavior problems per dog, with a range of 0 to 12. So 0 indicating that the owner believed the dog had no behavior problems.
Okay, all right. This next one is from Faye. She writes, your study revealed that most commonly the dogs with reported aggressive behaviors were the sole dog in the household. Do you think if these dogs had cohabitated with another, then the aggression issues would have been less likely to transpire, since dogs are generally sociable animals? Dr. Dodman, if you'll start, what are your thoughts on that?
Well, you know, the first thought would be, you know, that dogs are social animals, and to have a single dog is probably not the best thing for it. And these solo dogs in the study did seem to exhibit aggression more commonly. But the fact is, if you do add a second dog, which is good for the dog to have company, that won't necessarily solve your behavior problem. And in fact, it could even make it worse. I acquired another dog that was a rescue, and it taught my dog to engage in sort of violent predatory behavior. The dog was a black and tan coonhound, and he really taught my dog how to run away and hunt, which I wasn't terribly pleased with. Fortunately, that's resolved now. But of course, another problem, inter-dog housemate aggression, so-called sibling rivalry, you can't have that when there's one. So I hate to be vague, but it sort of depends. Separation anxiety is a problem that is not solved by adding another dog, but sometimes there are dogs who become bonded to each other, and when one disappears, now you've got a solo dog who has a problem with anxiety. So it's not just a simple get to and you don't have a problem, it can cut both ways.
Well said. Well said. They teach them the good or the bad. Misha's saying the chicken or the egg. That's right. What came first? Vivian, this next question is for you. Quite a few people asked on our input on punishment methods like choke collars, pinch collars, electric shock collars. Can you touch on that?
So the question would be what?
The question is what, from our study and from what we've found and your experience as a professional, what is your input on these methods since they're found so counterproductive?
Well, I mean, we would never utilize any type of punishment, any punishing training methods or equipment, because it only serves to it is counterproductive, and it only serves to alienate the dog further or teach the dog to avoid the punishment, right? So, and it causes extreme distress, and it further inhibits learning, right? So we want to allow the individual to be able to make a choice, right? And even if it's the wrong choice, at least they're not nervous, right? Or distressed about it. So it's certainly counterproductive. And I'll say on, my philosophy, as well as my practice, is to use least intrusive, minimally aversive methods. And on behalf of the CCBS team, Dr. Dodman and everyone, we all advocate least intrusive, minimally aversive. And if those of you who may not be familiar, the Council of Certified Professional Dog Trainers, ccpdt.org, International Association of Behavior Consultants, IAABC.org, and APDT.com, as well as, I believe, KPA signed off on a joint standard of practice. It was published in 2018, I believe, at the end of 2018. But you're welcome to go and check it out there. It's a staged approach to teaching. And there's, we don't want to be going to using punitive methods, punitive to the learner. So, yeah.
Yeah, well said. No room for barbaric treatments, that's for sure. Talking about tools, Dr. Dodman, we received many questions about muzzles. Can you talk about the findings on muzzles and how they affect aggression cases? And then along that line, our abstract noted that muzzles decrease the probability for successful treatment of aggression. And do you think that'd be due to the lack of conditioning to the muzzle or barrier frustration due to wearing the muzzle? So couple part question. Let me know if you need me to repeat that.
Well, first of all, I would use muzzles occasionally in my practice, usually basket muzzles. Those sort of sleeve muzzles are really, we call them veterinary muzzles, and they do impair breathing. So especially on a hot day, it's just totally not appropriate. So a basket muzzle, like a brand like Baskerville, just fits around the nose like they put onto horses to stop them chewing on the edge of the stall. And what it does is it's simply a preventive tool. So if you've got one dog seriously hurting another dog and you really need to intervene, save veterinary bills while you work on some other program, a muzzle is sometimes helpful. Or a dog that bites people on walks, you might want to fit him a muzzle, and that you can walk him and know he's not going to hurt anyone. It's not a training tool, it's just a preventive device. It was curious in our study that we found them to be counterproductive. They're not meant to be a training tool, but why would they make things worse? And that's really anybody's guess. I think perhaps that people use the muzzle instead of training. And that's not the right way. It's you would use a muzzle to stop biting, but the training should go on nevertheless. And I had just one story to illustrate that point. Was two dogs in a household that were fighting with each other and injuring each other seriously to the point of veterinary attention. One time I muzzled both dogs, and when they were in each other's presence with a basket muzzle for over 8 months, didn't bite each other, they were peaceful around each other because they knew they couldn't bite. And after 8 months, we took the muzzles off and they just started fighting again. So that would be the use of a muzzle, and not a positive result in the end. But you're right, it could be a form of barrier frustration also. It's really anyone's guess, and it probably depends on the circumstance.
Yeah, that's a good point. That's a good point. The next question is a perfect question for you as a veterinary behaviorist. Are there any new medication modalities showing promise in the treatment of various behavioral issues in companion animals that are worthy of consideration when traditional treatments aren't working?
Well, the world of medicine, there's kind of nothing new under the sun. I mean, at least the world turns very slowly. There are a collection of drugs that work on different pathways. And for example, if aggression relies a lot on norepinephrine as a neurotransmitter in the brain, drugs that block norepinephrine will tend to have an anti-aggressive effect. Drugs that increase serotonin will tend to have a mood stabilizing effect. They're the same old characters that have been around and around. Nowadays, people talk about trazodone as being a new addition to the armamentarium. Fact is, the drug is as old as the sun. It's just sort of been reborn with a different coat on. I don't particularly find that drug effective, as a matter of fact. So the only thing I think would be a breakthrough coming around the pike, CBD. You have to be very careful with CBD, because while CBD derived from hemp is now legal, federally legal, it's permitted, and veterinarians are allowed to do things that medics are allowed to do. The fact is that doesn't apply in all states, so certain states still have very tough rules about it. And any CBD that is used has to have a THC, that's the active ingredient in cannabis that causes the psychoactive effect. That has to be less than 0.3%. But either way, it does seem to be particularly effective in treating anxiety. And anxiety is an often underlying factor in aggression. There's also, incidentally, a good analgesic that's been shown in a study in Cornell. And we just mentioned earlier that pain can be a factor in aggression also. So I would say that's round the corner. It hasn't quite made it, and some vets still rather reluctant to prescribe it because of the complicated rules. The AVMA has not been very forthcoming, and their advice is a little bit curious, can be sort of taken both ways. But people just go out there, as we know from the study we've just done, when they do buy it online. If you do that, you've got to be very careful, because some of the products that are out there with brand names contain absolutely zero CBD, and others like Elevet, ELLEVET, which was the product used in the Cornell study, is what it says it is, and they have the dose right. And a word of caution, that even though it was very effective for treating arthritis in those studies, it did increase one enzyme in the blood, which is a kind of nondescript enzyme that lives in various tissues of the body, including the brain and liver and bone. So not all the dogs, but some of the dogs had an increase in that enzyme, alkaline phosphatase. So really, it'd be good to do blood work as well. But most people buying it online or in a store aren't going to know that and aren't going to do that. But I would say it's generally very safe.
Yeah, another good reminder to check with your vet and do that pre-blood work to make sure that all the levels are where they're supposed to be and everything's okay. It's a great topic. So Dr. Dodman, one more for you right now. Kelly asks, what does the latest research say about the types and reasons for aggression?
Well, there are so many different ways of categorizing aggression. It started with the classification of Muller classification from the 1960s, which is the one that most people use. Instrumental being an instrument of the dog's will, fear aggression, sexual aggression, intermale aggression, and so on. That's the one that's most commonly used. I would say what was formerly called dominance aggression is really instrumental aggression, sometimes fueled with fear. But there's another system used in pharmacology, which is basically offensive versus defensive, with predatory shelved on the side as a third type, if you like. That was the classification we used in our study. We had aggression that was directed internally from dogs to owners or from dog to dog living in the same house, and aggression directed externally to other dogs or people. And that is the latest publication, the latest way of defining aggression was actually in our own paper.
Look at that. All right. Shockingly, we have about 5 more minutes left. And, if we go a couple minutes over in one of our answers, stay with us if you can. But one of the questions I wanted to get to was from Sandra. She asks, how much aggression is from fear? How can you be sure training will help? And what kind of training would you recommend? And Dr. Dodman, I'd love to start with you, and then I'd like to pass it to Ian too, to hear his thoughts.
Okay, well, the late, great R.K. Anderson, inventor of gentle leader head halter, believed that 97% of all aggression was due to fear and anxiety. I think that's probably a little bit of an overestimate, but in a study we did, we found 44% of all dogs in this global study had anxiety as an issue. And I do think that anxiety and fearfulness do underlie many cases of aggression that we see. The one exception, of course, being predatory aggression, which is a natural behavior for a dog. Some dogs have high prey drive, some don't. So in the interest of time, I'll stop right there and pass over to Ian or Vivian.
So a comment on this, you can look at our 2019 demographics paper to look at the interactions between the various types of behavior problems. We produced a heat map, which is a correlation and strength matrix between each of the different types of behavior problems. So you can see, how correlated and how strong is that correlation between aggression and fear, and maybe aggression and compulsion, and aggression and any other behavior problem, and you can compare the different levels against each other. So we can give you some clue, but there is no definite number. Like we can't say 20% of all aggression is due to fear.
And I see a question coming through to the link to our paper. I will do that. I'll send everyone a link to the paper in the email as well. So after this event is over, you'll receive an email not only thanking you for attending, but with the links that we talked about today. So a couple more questions that we can get to. Vivian, if you can touch briefly on what the difference is between reactivity and aggression, because I think people use those terms loosely sometimes. So in your opinion, what's the brief difference?
Yeah, that's a great question. And they're often conflated, terms are often misconstrued and conflated among the general public and pet professionals, among us too, right? But reactivity would be, and they do differ. So reactivity would be a higher than normal response to some benign or harmless stimuli. So that would make perhaps a strange person or dog or an object or even a place, right? So benign to perhaps us, right? But not the dog. So the dog is reacting to their perception, right? So they might, to operationalize it or to explain what that might look like, the dog might avoid, might become hypervigilant, looking back and forth, might pant, right? So they're trying to avoid. Some dogs freeze, right? So people will, again, overlook that behavior as, my dog does nothing, but no behavior is behavior. So fidgeting, fear, avoidance, avoidance, I should say. So if that can be replicated and you're seeing it all the time to the same object or the same person or strange people, strange dogs, then we can surmise that the dog most likely is perceiving the stimuli as a threat. And it's based probably on their experience, right? Their past learned experience, right? So some dogs do shut down And again, some avoid, but others, if they're feeling trapped, will aggress, right? So aggression is just that, you know, I'm trapped. I need to behave in such a way to move the threat away, right? So the function of the behavior is moving the threat away. So then the perceived threat moves away, or if you're on the other end of the leash, you move your dog away, right? So it becomes a learned behavior, and maybe even a coping mechanism for the dog, right? And it becomes stronger and stronger. So aggression is a temporary emotional state, and it can be, you know, we might again operationalize it by we'll hear a dog bark and growl, and I would say never have your dog not growl, right? We always want our dog to, we want to know how our dog is feeling, right? Or how they're feeling about a perceived threat. And that's just information that we can file and then work on. But it is, the aggressive state is temporary. It is meant to move the threat away. And as Dr. Dodman mentioned in our paper, we did consider various types of aggression, including, you know, conflict aggression, and he went over all of the aggressive states that we considered, that I won't repeat again, but it's in our paper.
You're right, but I mean, I think that goes to show just how full that topic is, and how we could have, you know, maybe one of our next talks is about diving really into the difference between reactivity and aggression and those different layers. Because like you said, communication's key. Just with people, we have to keep those lines of communication open. So with that, I want to be respectful of people's time. It is 4 o'clock and we've come to the end of our first of many discussion events. And I want to thank everyone who attended today and thank our panel of experts for your time and expertise and contributions to animal welfare. And a reminder, CCBS is a nonprofit organization, and our research is made possible by the generous supporters like people like you. So if you could consider making a donation, any amount is appreciated. It allows us to continue doing events like this and continue our research and making the impact that we do on the lives of dogs and those who love them. So thank you once again. Donations can be given on our website, which is dogstudies.org. After this, I will be sending out an email to everyone with the links that we've talked about today. And Dr. Dodman, if you'd like to wrap it up for us as well.
Well, I'm just in a line because no time left, but I'd like to say thank you to everybody for attending. That, you know, we need more people. We'd like you, if you are a member, thank you for joining us. It's free. And if you're not, please consider joining our group, the CCBS. We call ourselves the Center for Canine Behavior Studies, and read about what we're doing, and perhaps you can participate in the studies. The more people that we get responding to studies, the more robust the results are. So we need people. Tell your friends, join up, read what we're doing, and you do get a quarterly newsletter with what we're up to. So that would be my final word, and thank you all for attending today.
Thank you.
All right, everyone. Thank you very much and have a wonderful afternoon.
Thank you.
All right, bye-bye.